Good afternoon, everyone. Welcome to our industry briefing. It's very good to have you all join us on this beautiful afternoon. So for those of you who don't know me, my name is Joanne Greenfield and I'm the agency's Chief Operating Officer, and I will be your MC for today. Before we get into our proceedings, I would like to make the acknowledgement to country. I acknowledge and pay my respects to Aboriginal and Torres Strait Islander peoples whose traditional lands and waters we're privileged to live and work on throughout Australia. For me, today I'm on Jagera and Turrbal peoples' countries, and I'd like to pay my respects to their elders, past and present, and acknowledge and extend that respect to other Aboriginal and Torres Strait Islander people and elders who may be joining us today. Just before we get into the proceedings, just a few housekeeping updates for you all. As you can probably see, the webinar settings should have put everyone on mute with cameras off. Please do keep yourselves on mute, especially anyone who's dialing in on a mobile phone, so that we can make sure we can hear everyone who presents today. Also, if you see the mute all button in Teams, please, it might be tempting, but don't press it, otherwise that will mute all our presenters. The chat and hand raising functions have been disabled as well, and presenters won't be able to see those functions if you try to use them, so please don't. We will have time for questions at the very end of the session, so please put any questions you may have in Slido. You can do that by accessing the QR code that you can see on the screen with your phone, and use the code. So the code is 2263497. When we get to our question session at the end, it will be moderated, noting we might not have time to answer everything today. Any questions that relate to the RFT, including those that the team answered today, will be addressed in writing and published via an addenda on AusTender. Any questions we receive today, including those answered today that are not directly related to the RFT, we will publish those on our website. We'll also publish the recording of this event, so anyone who hasn't been able to make it will be able to see, or you can go back and check anything you want to. We're really happy to be here today, and we're here because the agency released the application support, maintenance and services for the digital health infrastructure request for tender. As you hear today, we'll call that the ASM RFT. That was released on AusTender on the 30th of July 25. The RFT supports the agency's agenda for the transformation of the national digital health infrastructure, products and services. And you're going to hear a lot more about that today, particularly about providing real-time access to health information for Australians and their care teams anytime, anywhere. If we can go to the agenda slide. So as you can see today, we've got our key leaders today presenting and taking you through the content, the strategic vision and the content of the RFT. We've got our agency's Chief Financial Officer, Tara Gold, who will take you through the probity review. We'll then hear from Dr. Amandeep Hansra, who's the agency Chief Clinical Advisor, Medicine, who will take you through our clinical governance framework in respect of the RFT. Then we'll hear from Peter O'Halloran, the agency's Chief Digital Officer, on the strategic future vision of the agency, and you'll be able to see how this RFT fits with the bigger picture. Then John Borchie, our Chief Technology Officer, will take us through the operational context and what we're trying to achieve for this RFT. We'll hear from Julian Martin, the Branch Manager, Technology, Planning and Delivery. He will talk us through the scope of the RFT, and then we'll return with Tara Gould, who will take us through an overview of the RFT process. As I mentioned, at the very end, we'll move to questions using the Slido that I shared earlier. And a reminder, if you didn't get it, the code is 2263497. So I'll hand over to Tara now, who will take you through probity as it relates to the RFT. Thanks, Tara.
Thank you, Joanne, and thank you again, everyone, for joining us today for this industry briefing. Before we hear more about the RFT itself, I wanted to highlight that probity is an integral part of how the agency conducts any approach to market. As mentioned in this slide, probity is the evidence of ethical behaviour and can be defined as complete and confirmed integrity, uprightness and honesty in a particular process. The agency is committed to ensuring the highest standards of accountability, fairness and transparency in all approaches to market it undertakes. To support the agency in this commitment, you must ensure that you avoid approaching agency personnel directly or indirectly for the purposes of obtaining information about the RFT or agency strategy related to the RFT. Any communications, including any questions you may have about the RFT, should be directed in writing to the contact officer at asmprocurement@digitalhealth.gov.au. And with that, I will hand over to Adam Deebhansra, the agency's Chief Clinical Advisor, Medicine.
Thank you, Tara, and thank you everybody for attending today. So I'm going to talk a little bit about clinical governance, safety and quality improvement. So first of all, I just want to set the scene. For us at the agency, clinical governance is the backbone of safe, high quality digital health services. And for us, it's not just a tick box requirement. It's about making sure that every decision, every process and every interaction always puts safety and quality first. The agency has embedded clinical governance in the national digital health infrastructure, especially in the My Health Record modernisation work. And this matters because digital health systems directly impact patient care and outcomes. And we know that poor governance can lead to real harm, and strong governance can improve trust, safety and quality. So integrating governance into our priorities shows our commitment to what we call responsible innovation, always balancing progress with safety. So we expect from our partners for them to align with our clinical governance framework. So we're asking them to align with 5 key clinical governance principles. So those are, as I'm going to go through them, leading with our people, so making sure skilled, empowered teams with clear accountability structures are involved. Person-centeredness, so inclusive, culturally safe care that respects diversity. System safety and quality improvement, so proactive risk management and ongoing improvement. Evidence-based practice, so that's decisions that are driven by robust data and best available evidence. And obviously partnership, and that means working with consumers and diverse communities to shape better services. We want to see how governance isn't just in a document, but lived in day-to-day operations, and that it's really embedded in everyday practice. This builds a culture where safety and quality are a part of everyone's role, not just a compliance exercise. And the goal is for us to create digital health systems that are safe, inclusive, reliable, and trusted by the people who use them. And we know that when governance works well, it's invisible to the user, but deeply embedded in how services are delivered. So we look forward to seeing our partners adhere and align with our clinical governance framework, which is available on our website. And with that, I'm going to hand over to Peter O'Halloran, our Chief Digital Officer. Thank you.
Wonderful, and thanks, Amandeep, for that. I'll just talk for a couple of minutes, just I suppose really to ground everyone on the strategic vision of where this fits in the broader agency operations. So first of all, everything we're doing and we're talking about today fits underneath the National Digital Health Strategy, which is a strategy that underpins the delivery of digital health services across the entire Australian digital health ecosystem and is informed by all state and territory digital health strategies as well as Commonwealth's blueprint. In particular, then, a lot of what we're talking about will be covered under the Connecting Australian Care, the National Healthcare Interoperability Plan. And so if you're trying to see how this fits in the broader picture of what we're delivering, from a policy perspective, they're probably the key documents to look at. If we then look at it from a technology lens and the individual elements of the technology, you'll see really, and if we go to the next slide, Shauna, what you'll see for the technology is what we're talking about is a range of pieces that are being plugged together. And so we have a range of repositories that the Digital Health Agency operates. We have a range of repositories that are operated by other government entities that we interface into, and that's everything such as the Organ and Tissue Donor Registry maintained by Services Australia, a lot of the MBS and PBS data that we get from Services Australia that comes into national infrastructure. And we, of course, provide services out to all of the health providers across the country. One of the key areas on this that we're currently, and maybe topical for some of you to consider, is the procurement we undertook late last year in relation to the My Health Record on File repository, which will be modernising the primary repository for My Health Record. Obviously, that's a separate procurement from this one, so we won't be commenting on it today, but in the coming weeks and months, we'll be announcing the outcome from that procurement. And if we go on one more slide, Shauna, the next thing to emphasise really is there is an ongoing evolution of the digital health services that we do provide. And so some of you may have seen architecture that we've published previously. We continue to publish new sets of architecture. And in fact, the most recent one we published was the Health Connect Australia architecture, was released on our website recently, which is the next big iteration of where we're going with a lot of our national infrastructure, that will look at how we can actually support all digital health information being moved around the country. The importance of that work to this procurement is really to understand that the services that the agency operates evolve over time to meet changing government priorities and needs, and the needs of individual jurisdictions. So if we can go to the last slide. For Health Connect Australia, I just thought it's useful, and all this information, of course, is available through these slides on our website, but this gives you an idea that over the next 5 years is the timeline we're looking at delivering Health Connect Australia. And at this point in time, we are working on 2 key elements. The first is the directory, which will in essence be a provider directory for all staff involved in the provision of healthcare services in Australia. And we're doing some work around discovery in terms of national imaging, diagnostic imaging viewing capability. The remainder of the Health Connect Australia work plan will be prioritised and funded by governments as it fits in their strategic vision. But what I would emphasise is that this is an evolving piece, and we'll continue to publish updated architecture on our website every few months, and we'll continue to involve the sector as a whole in various public consultations as we make those evolutions. But with that, I'll hand over to John Borchi, our Chief Technology Officer.
Thank you, Peter, and that's great insight into our digital modernisation journey to help build a healthier system to support all Australians, which is what we're here for. So good afternoon, everyone, and warm welcome to everybody participating today. It's great to have you here. As Peter has highlighted and summarised, we have a very clear vision for the future of digital health, and it's equally important to have an appropriate foundation in the way that we provide support and maintenance of the delivery of those products and services. And that's in the current and future digital health infrastructure. So within that environment, we need to build the trust in the digital platform and deliver the intended outcomes for the healthcare industry. Next slide, please. I just wanted to briefly take you through the process that arrived at the ASM RFT. A lot of you would remember that as we started this journey, the agency released the request for information in November last year, and that was really to get industry insight into the technical advances, the process improvements and innovation in all the solutions that you as an industry have been putting in place across various sectors. And we had enormous and useful feedback in that process. So some of the key considerations from the RFI covered the potential segmentation of the services that we deliver, the technical or innovative advancements in the solutions and how provide the maintenance and support, and options for future expansion and scalability, and also driving efficiency through automation and the use of AI. So all those things have been incorporated into our strategy for developing the RFT. And I would like to thank all the organisations who were involved in that, because that was a very useful exercise. I do, however, want to emphasise that participating in the RFT is not contingent on having contributed to the RFI. The RFI was not a procurement process. It was that industry look at the innovation that's in the industry, and the RFT is the procurement process. Next slide, please. So I just wanted to give you a feel for what this new RFT looks like and what the contract has been designed to do. So the application support maintenance contract is mainly to allow the agency the flexibility to add or remove systems and products in support of that modernisation journey that Peter touched on. And that's for the entire term of the contract. And modernisation can include potential changes to the architecture, to the design, to the platforms and the systems within the supported environment. And the future vision of digital health infrastructure is based on how we implement this optimal delivery model for the agency. And that means that we really need a strategic partner to join us to deliver these ASM services. And in doing so, we need to maintain the development and improvement of the systems and products that we have and maintain them in a modern, secure, clinically safe and consumer-facing environment. So it is a very dynamic and changing environment that we're moving into. This ask from industry is very high priority for the agency, and it is a sizable request that we've put out to market. So I encourage all potential respondents to give it a go. And I think it's really important that we get the widest response possible. And I do thank you in participating in this and in your responses coming through. I do appreciate the industry engagement on this. I'll now hand over to Julian Martin, who's the branch manager for technology planning and delivery, to walk us through the RFT in a bit more detail. Thanks, Julian.
Thank you, John, and welcome everyone. As mentioned, I'll be taking you through the scope of the RFT in some more detail. The scope of the ASM RFT is to deliver ongoing operations, application support and maintenance enhancements to the application system components of the digital health infrastructure. The ASM contractor will be responsible for the security, stability, reliability, availability and robustness of the application system components in compliance with industry-based standards, including the agency's Service Integration and Management, otherwise known as SIAM, framework and system integration capability. The ASM contractor must also provide a high level of support for all users and responsive and robust support to the agency. This includes high quality service management and enhancement services through a dedicated and skilled workforce. This slide shows the services to be provided at a high level. I will note a few things to assist you in preparing your responses. Firstly, the agency will consider a hybrid delivery model, noting that any offshore contractor personnel will not have access to agency systems, My Health Record data, personal information, or any security classified information. Secondly, data extraction and the ability to access high quality data extracts is important to the agency to ensure we can meet our reporting obligations, such as supporting the sharing by default legislative framework, also for investigating incidents and providing valuable insights in relation to the usage of My Health Record. Further information on both of these points is contained within the RFT, and the tender response forms allows for tenderers to describe their proposed solutions. In my previous slide, I mentioned the application system components, and this term will be new to a lot of you, so let me explain this in a bit more detail. The application system components means that the system comprised of the following three layers. The presentation and access layer, identified in yellow on this slide, includes the API gateway, the APIs and portals. In red, the application and service layer, which includes My Health Record, integration services, application components and business orchestration. And at the bottom, the blue layer is the data access and storage layer. This layer includes the My Health Record data flows and data storage, and also the data extraction and reporting. This slide also identifies the components that are in scope for the ASM contractor and those components managed by the agency's infrastructure partner, which are out of scope. Also out of scope for ASM services is the development of APIs, unless requested by the agency on an ad hoc basis, and the My Health app is also out of scope. It is important to note that over time, the application system components may increase in alignment with the agency's transformation journey to modernise the digital health infrastructure. As part of the RFT, we've identified a number of in-flight projects that may impact the ASM services in some way. Information related to those current systems and architecture is included within the RFT, and I encourage all of you to ensure you have considered this information when responding. As I mentioned previously, the delivery of the services must be in compliance with the agency's Service Integration and Management Framework, SIAM, and System Integration Capability. This is integral for the agency and for all our vendor partners to achieve seamless delivery. Our SIAM operating model defines the policies and principles, establishes the ownership of roles and responsibilities, and although only a process, it comprises end-to-end process management. The agency's system integration capability is developing further as an in-source capability within the agency and will play the role of technical subject matter expert, coordinating and enabling technical alignment across cross-functional teams and fostering seamless cross-agency and cross-vendor partner collaboration. Transition in. This slide shows the indicative timeframe and agency expectations for transition in. We anticipate the contract to commence in early April with a discovery period where the ASM contractor will work with the agency and other vendor partners to finalise their transition in plan. Transition in will begin once the discovery period is complete, and the agency will be seeking insight from tenderers on their approach to staging transition in, for example, whether to do this by service or by system. The agency's expectation is that the final handover date will occur no later than mid-June 2027. To ensure that transition in is successful, the agency's expectation for the ASM contractor are shown at the bottom of this slide. While the agency transitions to the new ASM model, the ongoing stability and availability of the My Health record system will continue to be provided by the incumbent vendor partner. I would like to finish off by saying that we're seeking support from you to continue to deliver digital health infrastructure and applications to meet our current and future needs, and we look forward to hearing about your proposed service offering. Before I hand over to the next presenter, a reminder, if you have any questions following that, please make sure that you either scan the code on the screen or fill in your questions or use Slido code 2263497. I would now like to hand over to Tara Gould, our CFO, to talk more about the RFT process itself.
Thank you, Julian. Yes, the RFT process overview. The RFT itself is comprised of 5 different components. The RFT terms and conditions, which describes the process to be undertaken and the expectations of the RFT, and includes 4 attachments. Schedule 1 is the statement of requirements, which describes the requirements of the agency to be met by the successful tenderer and includes 26 attachments. Schedule 2 describes the evaluation criteria, which I will go through shortly. Schedule 3 is an important one to call out. It is the tender response forms, which tenderers are required to use in submitting a response to the RFT and includes 5 attachments. Schedule 4 is the draft contract. Schedule 5, the glossary. Tenderers should refer to section 1.2 of the RFT terms and conditions for the full list of documentation included in the RFT. The agency has established a secure virtual data room for the purposes of sharing with potential tenderers documentation that cannot be published publicly. To gain access, tenderers are required to provide completed and signed deeds of confidentiality, not only for the tender itself, but for any proposed subcontractors that the tenderer may be partnering with, as well as a singular completed data room access form. Note, with the agency's completion of its due diligence associated with the data room material, a revised deed of confidentiality was published with Addendum 2 earlier today. Please ensure you are using this updated deed of confidentiality when requesting access to the data room. There is a maximum of 10 individuals per tenderer that can be given access to the data room at any one time. tenderers can amend individuals with access during the open period by submitting an updated data room access form. The process for obtaining access to the data room is described in full details at clause 2.4 of the RFT terms and conditions. Mandatory requirements. In order to be found compliant, tenderers must meet the mandatory requirements, which consist of a minimum content and format requirements and conditions for participation. The minimum content and format requirements for the RFT are described in section 10.2 of the RFT terms and conditions, and include tenders are written in English, measurements are expressed in Australian legal units of measurement, tenders must include a full, completed and signed tenderer's deed of undertaking substantially in the form of attachment 1 to Schedule 3. Tender must include all valid and satisfactory statements of tax record, and the tender must include an Indigenous participation plan. There are two conditions for participation of the RFT, which are the tender must exist as a legal entity at the closing time, and the tender must hold all valid and satisfactory statements of tax record required for the tenderer's entity type and any first-tier subcontractors that it is proposing. We've provided a link on this slide to the Shadow Economy Procurement Connected Policy, which relates to the statement of tax records. Tenderers should familiarise themselves with the policy and ensure they are fully compliant. Process to obtain a statement of tax record can take some time, so tenderers should start the process as soon as possible. As a reminder, if your tender does not meet the mandatory requirements, it will be set aside from further consideration. The evaluation criteria. The primary objective of the RFT, in line with the Commonwealth procurement rules, is to achieve a value for money outcome for the agency. To do this, the agency will conduct a thorough evaluation of tenders received, which is described in detail at section 10 of the RFT terms and conditions. At a high level, the following sequential activities will be undertaken. Assessment of compliance against mandatory requirements. Tenders will then be evaluated against the evaluation criteria, which is described in Schedule 2. It is important to consider that there is no guarantee tenders will have a chance to present or engage with the agency beyond submission of their written tender. Tenderers should ensure that their tender addresses all the evaluation criteria and all sections and attachments to the tender response forms are complete, putting their best foot forward in this procurement process. If required, verification activities may also be undertaken through the evaluation process. The agency may shortlist and or set aside tenders from further consideration at any stage of the evaluation. The agency may also opt to conduct an offer definition and improvement activities. For more details on the potential on that potential process, refer to section 10.7 of the RFT terms and conditions. The evaluation criteria consists of two groups, scored and unscored criteria. Described here are the scored evaluation criteria. For more details, tenderers should refer to Schedule 2 of the RFT, which also provides guidance on the primary area of the response forms that relate to each evaluation criteria. A reminder, though, that the agency reserves the right to use any part of a tender in its evaluation of the evaluation criteria. Turning now to the unscored evaluation criteria, these will be assessed by the agency on a risk basis. All evaluation criteria will be considered by the agency, and tenderers should ensure that all information requested is provided to allow the agency to form a complete view of the offer. In forming a tender, you should ensure that you use the response forms provided and attach them as separate documents in your submission. A checklist of all required response forms is provided at section 1 of Schedule 3. Tenderers should retain the provided formats of the response forms wherever possible and make sure you answer all questions in sufficient detail to ensure the agency can fully understand and assess your offer. For ease of review and reference, ensure you provide your organisation's name or an abbreviation of it in each of the files submitted as part of your tender. Please ensure you don't use any special characters in your file names and be mindful of naming convention length. Tenderers should minimise the inclusion of supplementary material, but where it is required, ensure you provide sufficient context to its supply and how it relates to your tender. It is important that pricing information is included in the pricing-specific response form only. Lastly, the tender validity period for this RFT is 6 months. The agency is using AusTender for the RFT. We don't own it or have any control over its function. AusTender will not allow you to submit a tender after the closing time. Tenderers are urged to familiarise themselves with lodgement process in advance and allow sufficient time to upload their tender in full. If you are unfamiliar with AusTender, you can practice in the demo ATM at the link provided in this slide. Late tenders will not be accepted, except where it can be proven that the tender was late as a consequence of mishandling by the agency. AusTender will issue a receipt when a submission is complete. Make sure you see this screen as confirmation of your submission being complete. If you need support during lodgement, you can reach out to the AusTender help desk run by Department of Finance. On to our indicative timeline. The RFT was published to AusTender on 30 July. As previously mentioned, the data room is planned to go live on 11 August. So if you haven't already, make sure you submit your access request form to the contact officer. All potential tenderers are encouraged to send through any questions they have pertaining to the RFT through to the contact officer up until 5 p.m. Australian Eastern Standard Time on 10 September. The RFT will close for responses at 2 p.m. Australian Eastern Standard Time on 24 September. And our teams intend to have completed its evaluation by mid-January 2026. Note the dates of the evaluation are tentative for planning purposes only and are subject to change. As with all procurements run by their agency, we do require that all communication from potential tenderers is provided in writing via the contact officer, which for the RFT is asmprocurement@digitalhealth.gov.au. As per clause 5.2 of the RFT terms and conditions, if the agency is able to answer your question related to the RFT, it may do so via a published public addendum in AusTender. Once you've initially interacted with the AusTender notice, you should receive an auto-generated notification if any changes are made to it. But it is your responsibility to make sure you're up to date on any communication released in relation to the RFT. And finally, just a gentle reminder that any alternative communication methods should not occur, which would include any direct or indirect requests to agency personnel. That's it from me, so thank you for your attention and thank you for your participation in the session today. I will now hand back to Joanne to take us through our Q&A session.
Thanks, Tara, and thanks to all our presenters. If I could get everyone who presented just to come back on camera, that would be great. So as we said at the beginning, the presentation will go up online. So if you missed anything and the recording, you'll be able to review it all online again. We'll answer as many questions as we can today in the time we have left. Any of those that are related to the RFT and any that we run out of time to answer, we will publish as an addenda on AusTender, so everyone will see the full answers. Any of those that aren't related to the RFT we'll certainly publish on our website. So again, everyone can see the full answers. So we've got a number of questions in already. Julian, I might go to you for that first one, if that's okay. What could be the indicative % of API development would come in the future? And can we assume all new API development would be via an NSSR? And just for everyone online, an NSSR is a non-standard service request. It's a way that we provide additional services through a contract. Over to you,
Thanks, Joanne. Yeah, not a problem. So for that question, it all depends on the projects that we would have going on and or what operational imperatives we might have. And that would also influence whether it be an NSSR or something separate. To give probably a more detailed response for that, I think we'll respond to that in writing, Joanne.
Thanks, Julian. I really appreciate that. Julian, also for you, I think, can we get the last 6 months trend? Oh, it moved while I was reading it. The question's gone. It's the trend of data incidents and NSSRs in the data room, please.
Yeah, so I believe the incident and NSSR numbers are already going to be available in the data room for people that are submitting a tender response, and will get access to the data room, and we'll look into what level of problem and change information's there. Thanks, Joanne.
Thanks, Julian. Much appreciated. John, could you answer the question, is MHR open to the market? As I've understood from a public article, it's already awarded to Essentra.
Yeah, thanks, Joanne. So basically what we're discussing today is the application and support and maintenance contract that is for the digital health infrastructure. And part of that digital health infrastructure, the My Health Record is in there, as well as other systems and applications that Julian briefly mentioned. So the My Health Record is part of this new contract going to market. There is a transition contract, as Julian also mentioned, to maintain and support the system as we go to the market and identify the provider for the new contract. So that transition contract will remain in place because we're running clinically important systems that need to be maintained and continue to operate. So they're the two aspects of this contract and how we'll transition over time.
Thanks, John. Thank you very much. Do resources accessing the secure data room need to be onshore or hold clearances? Julian, could you take that one?
Yeah, not a problem, Joanne. So resources that are requiring access to the secure data room, the agency's actually seeking further guidance on the requirements for that access at the moment. So look for an addendum to be released to the RFT shortly, which will answer that question.
Thanks, Julian. And John, could you take that one? And maybe Julian can chip in. Does the cost of all the products underlying softwares of entire API gateway and My Health Record, including infra, I think that probably means infrastructure, are covered by the agency?
It's probably another question that we will provide more detail on, because it depends on how we work with the provider, the successful tenderer, to identify the components of the systems. So some of them might be operated and managed and supported by the service provider, and some might be by the agency. But in terms of how we run our digital health infrastructure at the moment, the majority of the production systems that are externally facing are agency managed and operated, so we pay for those. And then the tools to support and provide maintenance are equally split between the agency and the service provider. So it'll be determined as we go through the procurement process.
Thanks, John. And obviously it'll be part of everyone's submission and part of the evaluation in the tender process. Peter, this one's for you. Is the provider directory actually PCA, or is it something distinct?
It is actually, the provider directory is actually separate from PCA. Provider Connect Australia is a web front end that provides a series of updates to a different range of directories across the health sector. The provider directory itself is related but different. just to make it slightly more complicated, PCA will act as a future user interface into the provider directory for administrative staff and health services, but they are two distinct and separate products with very different backends.
Thanks, Peter. Much appreciated. I think we may be at the end of the questions that are being released today. Any questions that we've taken and haven't been able to answer within the time today, we will definitely provide a written response through the addenda. Oh, we'll just hang on and make sure that there are no more coming through. I know we've still got 181 people online, so people might still be typing. There we are. Fast fingers. Managed services should be on-site or hybrid model would be accepted. Julian, one for you, please.
Yeah, not a problem, Joanne. The answer to this question is either. We will look at the value of the proposal put forward by each vendor. There's no preference either way. A hybrid model is acceptable, but noting what I went through in my slides earlier, that anyone offshore will not have access to a lot of the information, and as long as those considerations are taking place, there's more detail in the RFT around that, and you can seek and offer your response accordingly once we've read more of that information. Thanks, Joanne.
Julie. Thank you, much appreciated. And you're right, the detail around the security requirements and the different models are all in the documentation. We'll just give it another minute or so and see if there's any more questions coming through. Is development services for My Health Record in scope for the RFT? John, did you want to start with that one?
Yeah, it probably depends what development services means. So in support and maintenance, there are a lot of components, as you will see from the RFT document, of what's in scope. And if someone in asking this question means the digital solutions development services, that's probably something we need to work out with the tenderer. If it's to do with support and maintenance services, that's something that the tenderer can provide us their opinion on. So we have listed in the RFT different options for how the tooling to provide support and maintenance can be delivered, and it'll just depend on the tenderer's response as to which way we go. We do have tooling in the organisation already, in the agency, for managing system integration, for example, for looking at service integration and access management. And that's to do with coordinating between different service providers with the different components of the agency. So they're tools that are in-house and being developed in-house. But yeah, it just depends is the answer. We can provide further details once we're working with the tenderers.
Thanks, John. Much appreciated. Remote access to the agency's environment, how is it managed, e.g. virtual desktop? John, do you want to start with that one?
Probably don't want to give too much information about this at this point, because it also will depend on the preferred tenderer's solution. The way that we do it obviously is secure, so it's not via the internet. There are several security measures in place. There was one point in time where there was no remote access, and then COVID changed all that. So we have different options with different providers at the moment based on what's secure and what passes our information security manual independent assessment as well. So virtual desktop, I don't believe is one of them because it's not considered secure enough, but there are other solutions in place.
Thanks, John. It sounds like it's very much depends on the tenderer, their solutions and our security requirements. John, this is also your area. What level of Essential 8 maturity is required across the environment?
It's actually more than Essential 8. And the systems that we're looking after in the digital health infrastructure are classified as protected, and that's in the RFT. So we'll be looking at the full suite of controls, not just these top 8, for the Information Security Manual that's released by the Australian Signals Directorate. So the tenderers have to comply in meeting those requirements and maintaining the systems at that level.
Thanks, John. The next one, Julian, I think it is quite a specific question. So do you want to respond to what is the role of the storage components?
Yeah. So look, a lot of these that are appearing on the, at least the first 2 there on the screen, Joanne, are probably more technical than to be discussed today. I think there is more detail in the RFT, but we will take away these questions, and if we realise there's a bit of a gap in what's in the RFT and what's being asked here, we'll respond to this question with an answer in writing.
Thanks, Julian. Much appreciated. So if we go to noting the broader national digital health strategy, are there any legislative barriers that must be navigated to support core system requirements? Peter, in terms of the digital health strategy and the My Health Record Act, it's detailed in the RFT, but did you want to add anything to that?
Look, what I would say, Joanne, is I think, and the RFT spells out a range of the legislation. What I would emphasise for respondents are there are specific requirements in the My Health Record legislation that are unique and specific to this. Those are in addition to any other normal legislative provisions that might be in place for operating in Australia. And so I would suggest that respondents seek appropriate advice as they need to, but certainly we have flagged some of the specific legislation that relates to My Health Record, for example, in the RFT pack.
Thanks, Peter. Much appreciated. Does the agency have a view of approach to transition of application system components, rebuild, transition current apps and rebuild over time? TBD in discovery. Julian, can I ask you to talk to that one?
Yeah, that's a fairly big question. I think that the agency has a real view on its digital strategy and where it's going. I think if we're talking about My Health Record in particular, the work to transition is to transition what's currently existing at this point in time. We're not looking in this process to be rebuilding it as part of that process, but that's not to say that the technology doesn't need to modernise over time, as per our slides and what I spoke to earlier about it will need to morph as we go on our modernisation journey. So I think it's probably as much detail as I can give to that at this point, but we will take that away and see if there's any additional commentary I can provide to that in writing.
Yeah, thanks, Julian. And I think we're looking really for vendors to give us their transition proposal, and that'll be part of the evaluation of the RFT. So thank you.
Sorry, Joanne, I might just add a little bit to that one as well. I think that goes to the core of the way we've designed the optimal delivery model for this contract. So flexibility is number one, like I mentioned, and there will be a lot of component changes along the way, whether they happen early in the piece or in a year or two or further down the track. That will be dependent on how we land the different modernisation activities, what products we choose. If we, go with what we have now, redesign or bring in a brand new product, I think that's what the core of this contract is about. So it's really important to emphasise that, because we want the tenderers to understand that this is an evolving environment that will constantly need to change. Thank you.
Thanks, John. Is there anything else any of the presenters want to add before we close for the session? No, it doesn't look like it. I really want to thank everyone who joined us. We had close to 200 people online. I really appreciate everyone's time today. Please do keep an eye on and anyone who registered will get an updated email when we release documents online in terms of the recording. Thank you for your time. It is an exciting time for the National Digital Health Infrastructure. There is a lot of modernisation journey to go on, and we look forward to receiving all the tenders. Thank you.